Creating and maintaining a sterile field and following aseptic principles should be observed during application of the amniotic tissue. This includes the use of sterile gloves and properly sterilized instruments. The setup includes anesthetic drops, a speculum, eye spears, forceps, the amniotic membrane, and a bandage contact lens. Open the outer pouch and introduce the sterile inner pouch to the sterile field. Open the inner pouch, exposing the allograft. Use smooth-tip forceps to remove the allograft. Care should be taken as the tissue is light. Since the product is dehydrated, the less time it is exposed to the room environment, the better. Don't open the inner pouch until ready to apply. The stromal side is visible and should be placed on the ocular surface. Additional contents in the product package include an allograft tissue information and product preparation insert, product information file stickers, and a self-addressed stamped tissue tracing card. Application. Administer topical anesthesia. Place the eye speculum in position. A drop of natural tears might be useful before placing the graft if the ocular surface is excessively dry. Remove the graft from the inner package using forceps and place the graft on the cornea. Body heat may make the graft curl upward slightly. Use the side of the forceps or eye spear to smooth the graft to the corneal surface. Apply the appropriate bandage contact lens to cover the graft. Apply appropriate medications as needed. The patient may apply a preservative-free artificial tear post-application as needed.